Good morning, good afternoon, or good evening to you from wherever you are joining us today. My name is Dawn Siebert, and I'm the Senior Science Advisor of the Centers for Disease Control and Prevention's Antimicrobial Resistance Coordination and Strategy Unit. It is my honor and pleasure to be the moderator for today's webinar. I want to welcome all of you to this sixth CDC AMR Exchange webinar in our series, titled Combating AMR Together, CDC's Global Antimicrobial Resistance Laboratory and Response Network. Antimicrobial resistance, referred to as AMR or AR, is one of the greatest global public health challenges of our time. It's an ever-changing and increasing threat that has the power to undermine the technological advances and extensive progress made in modern medicine, food production, and life expectancy. The purpose of this series of AMR Exchange webinars is to share information on cutting-edge research and impacts in the field of AMR, and to drive the field forward in our efforts to combat AMR by sharing what we are learning and what's working, and to engage partners, practitioners, policymakers, and the public to collaborate across One Health, healthcare, industries, community, and the environment on AMR topics. So first, I would like to take a quick look at the results of the two pre-webinar poll questions that you were asked to answer. Okay, very good. Excellent. Okay, so you all saw those results, and as you can see, most of our participants are still very concerned about global prevalence of AMR and the risk of future AMR threats, as well as participants agree that coordinated One Health actions are necessary to address existing and emerging AMR globally. So as you can see, these results confirm the importance of this webinar and the information that we're going to discuss today regarding our CDC efforts to strengthen the ability to address AMR around the globe. So let's get started. It is now my pleasure to introduce you to the four partners who will be talking with us today about their specific work as part of the Global AR Lab and Response Network. Arnaldo Colombo is a professor of medicine at the Federal University in Sao Paulo. Christy Kubota is the manager of the PulseNet program in the Food Safety Department at the Association of Public Health Laboratories. Sue Wong is an infectious disease physician, scientist, and professor of medicine at the Ohio State University Global One Health Initiative. And Fernanda Moreira is the chief of the International Infection Control Program and the Division of Healthcare Quality Promotion at the U.S. Centers for Disease Control and Prevention. Welcome to all of you, and thank you for joining us today to share your knowledge and thoughts.
Hello, everyone. First of all, I would like to thank for the opportunity to interact with you in this section and present our perspective on how to map and control antifungal resistance against Candida in a country with more than 200 million inhabitants. With support from CDC, we are closely working with Fiocruz and Minister of Health to build a network of sentinel hospitals and laboratories, reference laboratories, that will be able to perform Candida identification and antifungal susceptibility against Candida. I would like just to remember that we are in a region where investments for fungal diagnosis is very limited. A recent paper published in LATA documented that less than 10% of all reference centers in Latin America have the capability to run tests that are necessary to do diagnosis of fungal infections. And the first step and a major target of this project with CDC was to obtain a minimum capacitation of participant centers and investments in training human resource on diagnosis of fungal infection with specific focus on Candida. During the first year, we incorporated a total of 13 sentinel hospitals that were trained and received reagent and tests for realizing identification based on micromorphology, we provided them with chromogenic agar, able to screen most species, relevant species of Candida, and then antifungal strips with gradient of antifungal strips with gradient antifungal tests, and they received training for using that. We incorporated, as I mentioned, 13 Sentinel centers. During this year, we expect to incorporate 25 additional hospitals, representative of 10 out 27 regions from Brazil. By the end of the project, we will have at least one hospital for each geographic region from Brazil. That was the way we approached it, to have a minimum capability of those centers that will provide data to map the landscape of antifungal resistance in Candida, as well as to have, they will be capable of starting strategies to control the dissemination of fungal resistance.
Thank you, Arnaldo. I appreciate that introduction. And we will I have some more questions for you. But I think what I'd like to do first is show some slides about the background of the Global AR Lab and Response Network. So I have this distinct pleasure as the moderator to be able to do this as the lead of the Global AR Lab and Response Network here at CDC. And I think this background information will help to provide some context for the discussions that we're going to have across all of our speakers. So as part of the CDC work within the U.S. National Action Plan to combat antibiotic resistance, or CARB, under Goal 5, which covers international efforts, we established the Global Antimicrobial Resistance and Response Network. You're going to hear me refer mostly to it as the Global AR Lab and Response Network to shorten it a little bit. This is a broad-reaching One Health approach to improve the detection of antimicrobial resistant threats and prevent their spread globally. The network currently spans nearly 50 countries and works within more than 20 organizations worldwide to identify risk factors driving the emergence and spread of AR threats, and to respond to threats on the ground, including those found in healthcare, the community, food, animals, and the environment, including water and soil. Next slide, please. The Global AR Lab and Response Network builds on CDC's successful domestic AR lab network by addressing critical detection and response gaps globally. So this includes building lab capacity for high quality AR testing and supporting outbreak response when threats are reported. The network builds upon and expands global efforts already underway or accomplished by CDC, public health partners, and collaborating countries. So it is intended to better coordinate and collaborate across efforts without duplication, while also enhancing communication between laboratory and epidemiology and fostering knowledge and sharing among network partners. Next slide, please. The bacterial and fungal pathogens addressed within the Global AR Lab and Response Network are the same as within our domestic efforts, and are those that we've identified as the top priority AR pathogens that impact human health. These include healthcare-associated infections, and with a large focus currently on carbapenem-resistant enterobacterales. Enteric infections with a focus on drug-resistant Salmonella typhi and non-typhi, drug-resistant Candida auris and other Candida species, azole-resistant Aspergillus fumigatus, Streptococcus pneumoniae, Neisseria meningitidis, and Bordetella pertussis, as well as resistant Neisseria gonorrhea. Next slide, please. As I previously mentioned, we use the Global AR Lab and Response Network to connect and collaborate across existing AR work. So under this umbrella of AR efforts across the One Health spectrum, the healthcare-related efforts are through the Global Action and Healthcare Network, or GAIN AR module, as well as the Antibiotic Resistance in Communities and Healthcare, or ARCH projects. Some of the enteric pathogen-focused efforts are through the Polson International, and others build off of CDC's Global Water, Sanitation, and Hygiene, or WASH efforts. The global focus on Candida auris and other Candida species follow specific protocols that result in an upload of antifungal resistant data into the World Health Organization's Global Antimicrobial Resistance and Use Surveillance System, or GLASS. The resistant invasive bacterial and respiratory pathogens are using and enhancing established testing protocols, and the resistant gonorrhea work uses the Enhanced Gonococcal Antimicrobial Surveillance Program, or EGAS protocols. So as you can see, we're not starting from scratch. We're using established networks and platforms when they do exist. Next slide, please. So this slide shows the comprehensive picture of the extensive AR work being conducted across specific countries around the globe. As you can see, we have a very broad reach, and some countries have multiple efforts underway to address different resistant pathogens. So now I'd like to begin our conversations with our four speakers. So I'll first note that with the numerous efforts that I just highlighted and that you can see on this map across the globe, I'm sorry that we cannot talk with more of our partners and discuss all of the important work that is underway across our many high priority AR pathogens. But in the interest of time, we chose a few to highlight with you today, and we look forward to highlighting additional work at another time. Okay, Arnaldo, back to you. So I'd like to get back to the questions and the information from you. Before we start, I would like to see if you have any more background that you would like to provide on yourself to the participants. If not, I can go right into the questions.
Dr. Silver, thank you for the opportunity once again. Sorry, I was so excited to present data from Brazil that I crossed your talk. Anyway, I am an infectious disease specialist who ran a lab in Brazil for giving support to research, education, and policymakers in terms of how to deal with early diagnosis of opportunistic infection, how to understand providing data on the burden, natural history, and strategies for controlling Candida infections.
Perfect.
And,
thank you so much. And absolutely no worries. We're all very excited to be able to show all the information and present our data today. So what I'd like to do is go back to an initial question, because in asking the question, it will just introduce some terminology that you may be using in some of your responses. And I'd like to make sure that the participants are aware of the connections of the institutions. So your institution, the Federal University of Sao Paulo, sometimes referred to as UNIFESP, works with Oswaldo Cruz Foundation, sometimes referred to as Fiocruz, through the Foundation for Scientific and Technological Development in Health, referred to as FIOTech. So we use those acronyms a lot, and I want to make sure participants understand what they are. So again, in collaboration with CDC's Global AR Lab and Response Network and CDC's Mycotics Diseases Branch, as you started describing, you're working to support Brazil's National Public Health Laboratory Network to strengthen AR detection and reporting in Brazil, again, with a specific focus on Candida and antifungal resistance, as you mentioned. So can you please describe to us how Fiocruz and UNIFESP are carrying out this work within the Global AR Lab and Response Network?
Yeah, as I mentioned before, this is a very important study for our region because capacitation and diagnosis of fungal infection is a limitation in the full region. And then the first aspect we needed to surpass was what we are going to incorporate as strategies for early identify and screening species of Candida and fungal resistant in Candida. We have less than 10% of our reference centers with full capability to identify Candida by proteomics or genomics, as well as for processing antifungal resistant tests by microdilution. Then our decision was to start with something very basic, that's micromorphology of yeasts, complemented by morphological aspects of the cultures expressed by Chromagra candida. That's chromogenic media that provides different colors for different species of Candida. This strategy has some limitations, but during the full period of study, we will receive all isolates in the national support lab that's in our university to do sequencing, proteomics, and microdilution of all the isolates. Then what we are doing is capacitation of Sentinel centers to have a quick response to the patients to provide us data on identification and fungal susceptibility by using those two tools. They were trained by web, they are trained by interaction. We have with them monthly since this year 2023, and we expect by the end of the year have data on 500 different episodes of candidemia that will be analyzed by them, and data will be confirmed locally in our institution. I'm very glad that we get the support from CDC. I'm glad that Fiocruz and Minister of Health invited us to give support to this strategy that's focused on Candida. Just to remember that we have another branch, another study with Ana Paula, Marcelo Piloneto, that's take care of the full analysis of bacterial resistance.
Thank you. That's an amazing amount of work. And I appreciate that you described the detail of how you're working with the local laboratories and hospitals and the type of testing that you're doing and the way you're receiving the fungal pathogen isolate. So thank you for covering that. So how has this collaboration impacted the detection and response of Candida species in Brazil? Meaning, what have you seen so far as results? And has there been any specific instances where the expansion has helped to identify the source of an outbreak or helped stop the pathogen before it could spread?
Yeah, that's a very important question. Thank you. How did it impact? First of all, we started to detect resistance in some public institutions, and then we are having a periodic meeting with them to provide the results and discuss what to do. We are going to add this information to the Brazilian system and also to the WHO system, who collect data from Candida resistant in different parts of the world. We are capacitating the sentinels. During the first year, they will not report data to patients and clinicians. They will report just to us because they are being trained. After the second year, if they do a good job, they will start responding to patients. And responding to your specific question, yes, the system helped us to control the second outbreak of Candida auris we had in Recife. Right at the beginning of this study, we had an outbreak in a 900-bed hospital. That's a reference hospital for trauma, large hospital in a large city, public hospital with limitations in terms of research. And then we did several conferences with all actors and players related to the infection control program, that particular hospital, with people from ICU, people from the surgical unit that were involved in the outbreak, reinforcing all the measures we should adhere to control Candida auris. We send two researchers from our center to visit the hospital and to be sure that they were processing the isolates, the collection of isolates, the cohorts, the disinfection of the hospital in the right way. And we followed the hospital for 6 months with conference every 15 days to check what they were doing. And I'm glad to say that after 6 months, we succeed and we controlled this outbreak. One detail that's important to mention is that during that period, there was one hospital that was closing their activities for COVID-19, and we could do interaction with hospital to decrease the number of patients admitted in ICUs in the hospital where we have the outbreak, in order to decrease the clinical pressure that the 900 hospital bed had during the period of outbreak, and then it was easier to control, to disinfect the hospital, to have the adherence of the clinicians to what we need to do to control Candida auris. Then this, we are not just promoting capacitation, we're not just promoting data, and landscape of fungal resistance, but we are actively responding and controlling outbreak of Candida auris, as I mentioned.
Well, thank you so much, Arnaldo, and thank you for walking us through that. Congratulations, that sounds like a great success. It sounds like this work is very timely for what is needed. And so we really appreciate your collaboration. So I'd like to thank you for presenting with us, and I'm going to switch now over to Christy. I have some questions for you, Christy. Welcome.
Oh, thank you, Dawn, for having us and giving us the opportunity to discuss Polson International.
Super, thanks. First, I want to give you a little minute to provide background on yourself for participants before we go into some questions.
Sure. I've been with APHL for 15 years. I've been associated with the PulseNet network for more than 20, working at CDC, starting out with the Enteric Diseases Laboratory branch, and then moving over to APHL to help in capacity building for both domestic and international PulseNet activities.
Excellent, thank you. All right, so let's jump in. So as you described, your work with Polson International, and it focuses on tracking foodborne infections globally, including resistant ones. So how are Polson International and the Global Air Lab and Response Network working together to improve data collection of resistant enteric or gut pathogens in Southeast Asia?
Yeah, so a little bit of background on PulseNet. Polson International was established in the early 2000s as a network for developing standardized methods for characterization of bacterial enteric pathogens such as E. coli, Salmonella, Shigella, Vibrio species. And at that time, we were using pulse field gel electrophoresis. Around mid-2012, 2013, PulseNet began transitioning to whole genome sequencing methods, which allows for more efficient characterization of enteric bacteria. And it allows us for the consolidation of public health microbiology workflows. So this allows not only for us to be able to subtype pathogens for outbreak detection, but also to look at other virulence factors, including antimicrobial-resistant profiles. So this collaboration with the Global Antimicrobial Resistance Laboratory and Response Network, we feel will really improve the data collection efforts by enabling public health laboratories to utilize these genomic characterization tools within Polson International laboratories, not only within the Asia-Pacific, Southeast Asia region, but elsewhere in the world.
Excellent, thank you. Thank you for that information. And so we all know that enteric pathogens can be found in healthcare, the community, food, animals, and the environment. So why is it important that laboratories across countries, regions, and the world have the capacity to identify resistant enteric pathogens and share this information quickly?
Yeah, it's critically important that public health and the scientific communities understand the population dynamics of drug-resistant enteric bacteria circulating within regions and globally as well. I think the effects, not only the treatment decisions at the individual patient level, but also helps with developing mitigation and prevention strategies at the population level as well. APHL, in collaboration with Ben Howden's group at the Peter Dorothy Institute for Infection and Immunity at the University of Melbourne, there are Polson Asia Pacific coordinators. We have together launched a feasibility study with public health laboratory scientists from Malaysia, the Philippines, Thailand, Taiwan, and New Zealand. And this study is to help promote and demonstrate the use of genomic methods among these countries for the detection and monitoring of the drug-resistant enteric pathogens circulating not only within the countries themselves, but regionally as well. So, we hope to use these standardized genomic methods and for both the wet lab and the bioinformatic analyses. And these tools will allow for the rapid data sharing, which is critically important in identifying emerging drug-resistant variants and enteric pathogens.
Thank you. So that sounds like a very strong collaboration and very extensive across the Asia Pacific region. So a lot of exciting work happening there.
Yeah.
So I know we're a little bit early on in the work and all of the efforts, and Polson International had been going, and we added on through the Global AR Lab and Response Network for some more AR focus and to help support. Have you seen successes to date from this collaboration between CDC's Global AR Lab and Response Network and Polson International?
Right. I think our early successes have really been establishing our strong partnerships early on in the initiative. And I think this really helps build a really strong foundation for us to implement this work in a pretty timely fashion. As you mentioned, Dawn, as we're in the early stages of the initiative, but our initial successes have actually included a successful in-person training. We trained 13 laboratory scientists in both the wet lab and the bioinformatics workflows at the University of Melbourne back in February of this year. We also developed bioinformatic workflows for this work. So we're enabling not only the analyses, but data sharing among our participants participating in the study. So, although we have we've trained everyone and so forth, we've actually started sending out reagents to the sites, and laboratories very soon will start sequencing 100 bacterial enteric isolates. So we're really excited to see some initial data that will be generated by these sites by the end of the year. So we're really looking forward to the results of our study. And this data, not only will help support enteric disease outbreak investigations as we learn more about the pathogens that these laboratories are sequencing, but also, we'll be able to identify AMR in more rapid, coordinated, and robust way.
Excellent. Thank you so much. Thank you for sharing all of that great work, and we appreciate you being a part of the Global AR Lab and Response Network. Thank you for sharing with us. Next, I'd like to move to Sue. Welcome, Sue. And I'd like to give you an opportunity to take a moment to provide a little more of your background for our participants.
Thank you, Dr. Siebert. So my name is Sue Wong, and I'm infectious disease physician and professor at The Ohio State University. I'm also the director for OSU Global One Health Initiative. If I may, I would also like to acknowledge our in-country Ethiopia director, Dr. Ebba Abadi, as well as the wonderful and dedicated AMR team, both in Ethiopia as well as here at OSU.
Thank you. Thank you so much, Sue. And as you stated, so you currently lead the Ohio State University Global One Health Initiative, and I'm told sometimes it's called the OSU GOH in Ethiopia. So CDC has partnered with you on this work for many years. Can you please tell us more about the work of GOH and the gaps your team are addressing across healthcare facilities?
Thank you. Yes, we've been working in Ethiopia, first under the Global Health Security and now under GAIN AR. So we've been working really with a lot of leadership at the beginning with Ministry of Health, Ethiopia Public Health Institute, with the National Reference Laboratory as Health, CDC Ethiopia and country, as well as leadership for healthcare facilities and other stakeholders. Our goal here is really to strengthen laboratory capacity and build up infection prevention and control, or IPC practices. So we've been able to identify several gaps, and we've been providing training such as in hand hygiene, environmental cleaning and disinfection, specimen collection, and monitoring and evaluation. And then for the lab, we've been actually supporting bacterial detection, identification, drug susceptibility testing, really focusing on multi-drug resistant pathogens such as CPCREs or carbapenemase, producing carbapenem-resistant Enterobacterales.
Excellent. Well, thank you. So as part of the efforts to combat emerging antimicrobial resistant threats worldwide, the Global AR Lab and Response Network includes work implemented by partners, again, like you mentioned. We're working through GAIN AR, the Global Action and Healthcare Network Antimicrobial Resistance Module. And so this work addressing emerging antimicrobial resistance threats in healthcare systems at the local, national, regional, and global level. Can you let us know how GAIN AR supports the GOH work and why it's valuable to support similar initiatives in under-resourced settings?
Yes, GAIN-AR has been supporting GOHI's mission to really decrease antimicrobial resistance in humans across health systems. And then really by collaborating with these partners in Ethiopia, together we can provide the training, mentorship in selected sites. And for the laboratory, we're really ensuring that standard laboratory practices are done properly and accurately. I really feel that the lack of standardized advanced techniques and then reagents and supplies to detect these multi-drug resistant pathogens such as CPCREs is really a challenge in Ethiopia and other countries of low resource settings. So GAIN-AR has been really helping to overcome this barrier. So by establishing critical laboratory capacity, improving workforce capabilities, and also enhancing IPC practices. Really, the link between laboratory and IPC is so critical in order to combat AMR in the healthcare settings. So by working with these key stakeholders, I feel that GAIN-AR has been able to benefit not just the local facility where it's working, but the value and the impact is really expanding beyond that to the regional, to the national, and ultimately globally. I think it will improve and ensure good healthcare delivery.
Excellent, thank you. And so again, you're working and leading and you're aiming to contain and prevent the spread of dangerous resistant pathogens, specifically in healthcare settings, as you said, and to protect patients. And again, I know it's still relatively new working under the Global AR Lab and Response Network, but what have been some of the lessons learned from this work, and has there been any impact measured so far?
Yeah, thank you. So we really feel that in order to have commitment, we learned early on that it's not just getting commitment from the leadership, but every single member of the healthcare team. So we do these multiple trainings that are interactive, hands-on, and we really try to emphasize the importance of each member. So we're training them on, again, IPC practices, laboratory, techniques and improvements, and then their role in this bigger picture. So OSU GOH infection prevention control officers, as well as laboratory technicians, are actually working at the Sentinel sites and directly assisting the lab and the IPC capacity within our target prevention units and within the hospitals. We're really hoping that by doing this, we can really utilize the data. So for example, the data that we're starting to get from microbiology lab can really help to guide clinicians in terms of their decision-making to improve healthcare outcomes for the patients and decrease morbidity and mortality. And the practices that are implemented, I really feel are coming up, and we are actually seeing improvements in hand hygiene, in environmental cleaning and auditing, and IPC practices when we're auditing at our target prevention units. Additionally, in the lab, we've been able to see increased laboratory specimen collection, improved communications between lab, as well as the clinicians on the floors. And then we are actually now starting to detect carbapenemase resistance within the cultured isolates that we have been collecting. So really exciting times.
That sounds like exciting times. That is a lot of great successes. Thank you for highlighting all of those for us. And thank you for all the information. I think now I'm going to move to Fernanda. So Fernanda, welcome. And I'd like to allow you some time to take a moment to provide a little more background for our participants.
Thank you, Dawn, and good morning to everyone who is listening to us, or good afternoon, good evening, depending on where you are. My name is Fernanda Moreira, and I am an infectious disease physician by training. I'm originally from Brazil, and very happy to be here with Dr. Arnaldo Colombo, who I trained with back in the days. And I am a healthcare epidemiologist. I've been with the CDC for 17 years, and most of my career really focusing on global health. I am the chief of the International Infection Control Program, with really the mission to promote safe delivery of healthcare globally.
Excellent. Thanks, Fernando. We're happy to have you with us today. And this is a perfect segue with your leadership role at CDC, having heard from Sue talk about the GAIN-AR from her perspective and the part that she's working on. So would you please like to take the opportunity to talk about GAIN-AR as part of the Global AR Lab and Response Network efforts in healthcare settings from that broader perspective?
Yeah, no, absolutely, Dawn. Thanks for the question. And happy to tell you and everyone who is listening to us today about the Global Action in Healthcare Network the antimicrobial resistance module, known as GAIN-AR. GAIN-AR is a global network of hospitals, laboratories, and infection prevention control teams with the mission to protect patients and healthcare workers from critical and emerging AR threats. AR causes antibiotics and antifungals to lose their effectiveness, meaning we lose our ability to treat infections and control these public health threats. We know that resistant organisms can rapidly spread out of control both locally and globally due to transmission between patients, healthcare facilities, and even countries. The data from 2019 shows that over 1 billion travelers every year cross international borders. So an infectious threat in one country is a threat to other countries too, as we have seen with COVID and also with other infectious diseases. We can slow and prevent the spread of emerging highly transmissible AR, but in order to do that, we need coordinated global action. We at CDC believe that in the fight against AR, going together instead of going alone is critical. So GAIN-AR brings together academic institutions, public health organizations, ministries of health, national and public health laboratories, and healthcare facilities in a coordinated effort against AR. GAIN-AR seeks to do the following. First, to enhance laboratory capacity in healthcare facilities and national and regional reference laboratories for a set of prioritized AR threats. Second, to prevent transmission of AR threats in healthcare facilities through implementation of evidence-based strategies. Third, to improve rapid communication of these threats within and across healthcare facilities. And finally, to work collaboratively across institutions, countries, regions, and global partners to prepare for and rapidly respond to emerging AR threats. Resource-limited healthcare facilities may lack expertise, laboratory capacity, data systems, and educational tools to combat AR spread. And being part of GAIN-AR can provide distinct advantages, including access to laboratory, infection prevention and control and stewardship expertise, training resources, standardized laboratory prevention and response protocols, new laboratory technology, shared data infrastructure, and access to findings, including novel discoveries and best diagnostic practices that can further optimize network activities. In collaboration with our partners, including the Pan American Health Organization, Ohio State University, Dr. Wang is here representing Ohio State University, Vanderbilt University, and Johns Hopkins, GAIN-AR is currently being implemented in 9 countries: Argentina, Belize, Chile, Costa Rica, Ecuador, Ethiopia, Greece, India, and Uruguay. And I invite everyone listening to us today to learn more about GAIN-AR, to visit our CDC's International Infection Control Program web page. Back to you, Dawn.
Thank you, Fernanda, and thank you for that extensive background on GAIN-AR to really get a full understanding of how broad-reaching and deep the collaboration goes in the work that you're doing within healthcare settings. So as you described all of that, I think I have an additional question as far as GAIN-AR efforts as part of the Global AR Lab and Response Network and supporting specific partners like the OSU GOH. How do you work with them to strengthen infection prevention and control in healthcare worldwide?
Thanks, Dawn. Yeah, GAIN-AR used the lessons learned from the US Antimicrobial Resistance Laboratory Network and also other international networks to support effective detection of AR organisms, with the goal to generate data for real-time action. Clinical and reference laboratories work together to detect and understand critical, emerging, and novel AR threats from clinical isolates and colonization screening specimens. And these data are used then for action. The initial focus of GAIN-AR is on carbapenem-resistant Enterobacteriales, or CRE, especially CRE that are carbapenemase producers. Many carbapenemase genes are on mobile genetic elements that can be transmitted from one bacterium to another, and thereby spreading resistance very quickly. Carbapenemase producing CRE are of high concern. As I said, they can spread quickly in healthcare facilities and can cause severe, difficult to treat infections. So GAIN-AR relies on laboratory detection of CRE from both clinical cultures obtained as part of routine patient care or from colonization screening through collection of rectal swabs. Colonization screening supports early detection of patients who are colonized with carbapenemase-producing CRE, meaning patients that carry CRE without symptoms of infection. And we know that patients who are colonized may spread CRE to other patients, healthcare workers, and others in healthcare facilities without knowing. So it is critical to rapidly detect infected or colonized patients to inform prevention measures, such as placing patients on contact precautions to prevent further spread of the organism. In addition to prevention, GAIN-AR also has a response strategy, which includes rapid IPC action after laboratory-based detection of patients with critical and emerging AR threats. And depending on the level of threat to the healthcare facility of the resistant gene detected, for example, a rare or novel type of carbapenemase gene, the response may consist of a very aggressive and systematic laboratory and IPC approach to actively identify and interrupt transmission of resistance in the healthcare facility. As part of the GAIN-AR, we have developed network guidance for detection, prevention, response. And these guidance documents provide a framework to be used across network facilities by their IPC and laboratory teams, and of course, with adaptation based on their local context. So it's not one size fits all. And it is to be used in conjunction with any existing national IPC guidelines. The CDC team, in close collaboration with our implementing partners, provide technical assistance for implementation of network protocols, deployment of existing or new laboratory technology, training for laboratory and IPC personnel, and assistance with sequencing of novel or rare AR threats. The network also promotes exchange of lessons learned across partners, creating communities of practice across its members. The goal is for GAIN-AR healthcare facilities to really serve as centers of excellence, providing assistance and sharing lessons learned to other healthcare facilities in the country for both lab infection prevention control, and really expand those efforts not only nationally but regionally across the network. So back to you, Dawn.
Thanks, Fernanda, and thank you for providing all of that detail again with the extensive work that's happening and the networking that is happening to make it successful. So again, as you said, and we've acknowledged, GAIN is a newer network. So can you please describe if there are any early successes for GAIN-AR specifically as part of the Global AR Lab and Response Network on detection, prevention, response to AR threats in healthcare?
Absolutely. And I will give the example of Argentina and Ethiopia. They are the two of our first countries to begin GAIN-AR implementation. And their work has been really exciting for us to watch because of the progress they are already making, and also because of how they are using innovation to overcome challenges. So I'll start by telling you a little about GAIN-AR in Argentina. As I mentioned earlier, rapid, accurate detection of carbapenemases and timely response following detection are crucial to prevent their spread. Patients may be colonized with CPCRE without having any symptoms of infection. So detecting these patients may take, several days using traditional methods. And our goal here is really to detect on a timely fashion to inform IPC measures. So the participating in hospitals in Argentina, with the support of CDC, the Pan American Organization, and the Argentina Public Health Laboratory, Anlis Malbran, have improved the speed and sensitivity of carbapenemase detection by introducing 4 new laboratory methods and streamlined laboratory workflows. So this change had added benefit of reducing workload on laboratory staff, but of course, this work did not come without challenges. So one of the new laboratory methods that was implemented in Argentina across the GAIN AR participating facilities was PCR, the expert CARB-R, which is more sensitive than the traditional methods and detect patients carrying carbapenemase genes within hours, allowing really appropriate precautions to be taken rapidly to reduce the spread. However, the approved rectal swabs needed for export CARB-R aren't available in Argentina. So to overcome this challenge, the National Laboratory in Argentina, Malbran, had to find locally available rectal swabs they could substitute. So they use approved swabs that we are able to obtain through the CDC South America Regional Office to complete a study showing that the locally available swabs in Argentina perform as well as the approved swabs. And this solution made CARB-R method feasible option across the hospitals in Argentina. So beyond improving the speed and accuracy with which carbapenemase are detected, Argentina Ministry of Health is working to adapt the National Informatics Platform, which will improve communication of detected carbapenemases across Argentina, allowing national IPC teams to assist more efficiently when needed. So let's move to Ethiopia. GAIN AR in Ethiopia has also used innovation to achieve success, although it's looked very different there than in Argentina, of course. As I mentioned earlier, surveillance and safe delivery of health services can be challenging when resources are limited. The participating hospitals in Ethiopia have worked to stretch limited resources using local markets and sustainable options whenever possible. So for instance, they commissioned the production of cloth gowns from local tailor, which can be laundered and reused multiple times. Another wise investment contributing to the successful GAIN AR implementation in Ethiopia is the hiring of local IPC and laboratory experts to directly mentor healthcare facility staff. These experts go beyond just providing lectures. They offer supportive supervision at least once a week to staff to provide immediate feedback and assistance. And through this process, both participating healthcare facilities in Ethiopia are observing improvements in IPC, such as hand hygiene and environmental cleaning. Additionally, laboratories in both hospitals are noting increasing laboratory specimen collection and are starting regular carbapenemase detection from CRE isolates. And while initial GAIN AR efforts have been targeted just to specific hospital units, the benefits are already being expanded into other areas of those participating healthcare facilities in Ethiopia. So for example, recently when a unit not participating in a GAIN AR notes an increase in laboratory detection of an AR organism, the IPC principles already being implemented on the GAIN AR unit were taught and applied to that unit in the healthcare facility. The collaboration in Argentina and Ethiopia are really excited to see the progress that they have already achieved in such a short time frame. And we really hope to expand this GAIN AR progress to other healthcare facilities across these countries. And I think that these are great examples of the kinds of progress we can make by really working together instead of working alone to address the problem of AR. And we at the CDC look forward to seeing many more successes in the countries that are participating in AMR and across, national level and across the regions. As I said, this is just the beginning of AR. Back to you, Dawn.
Thank you, Fernanda, and thank you for giving those specific examples of such innovative successes. So there was a lot of good effort and again, thinking outside the box and thinking beyond to make things work. So thank you for sharing those with us. Next, I'd like to pose one question across the speakers and allow each of you time to share your thoughts. So from each of your perspectives, what do you see as the future for the Global AR Lab and Response Network to ensure sustainable and comprehensive actions to combat AMR? And I think I'd like to go in the order that you all presented. So Arnoldo, I would like to start with you.
Okay, thank you for giving me another opportunity to talk. And I guess this is really one of the main questions is how to have sustainability in actions that now are being supported by CDC. Second question is, for how long we'll be able to contain the dissemination of Candida auris in our hospitals? We know that Candida auris has the etiology of several outbreaks in different countries. In India is endemic, in South Africa is endemic, in USA is endemic. Then going to the first questions about the sustainability, our idea is to map the situation of fungal resistance and to have some experience, some case that we will show to the policymakers and argue that if they support the system, they will help us to control with the same success rate we recently obtained with support from CDC, Minister of Health, and Fiocruz in combating Candida auris in a large hospital with 500 beds and a public system. And the idea is to accumulate situation, case, examples where simple elements, very simple tools, we're not talking about proteomics in each Brazilian public hospital. We are talking about very simple tests that are chromogenic media, micromorphology, and stripes containing antifungal gradient. I believe this strategy may help us to respond to the challenge of antimicrobial-resistant dissemination and to give data and insights for the policymakers to keep supporting the program. That's our idea. And we still have in our mind that's possible to contain the endemicity of Candida auris, hitting early and hard. I hope we'll be able to do it. Thank you for the opportunity. It was very good to share this session with these outstanding speakers.
Thank you, Arnoldo. Thank you for those thoughts. Christy, I'd like to turn to you now.
Yeah, thank you, Dawn, for the opportunity to address this question. It's really important as we look to start to build our network and partnerships across the international PulseNet regions. But again, I want to just reemphasize, the importance of partnerships. I feel will really be critical in maintaining our work and making it sustainable in the long term. We've done so much, and kudos, to the PulseNet Asia Pacific coordinators group and University of Melbourne. They've been outstanding, and really, working in countries with our partners we've already established with the 5 that I mentioned earlier, but expanding those opportunities to other countries, I think, will be critically important. And seeing our early successes early on in our feasibility study work, I think will be instrumental in providing that sustainability, and hopefully creating new partnerships outside of our public health, structure to, public-private partnerships, for example, I think are really important in helping engaging traction and interaction. And then just the integration, trying to figure out ways how we can integrate our work that we're currently doing to make it more sustainable in the public health workflow. So if we could integrate these tools and these processes that we've developed through our work with Polson International, I think that will tremendously help with sustainability moving forward. Thank you.
Thank you. Thank you, Christy. We appreciate your insights. Sue, I'd like to turn to you next.
Yeah, so I think for me, in order to have it be sustainable, we're kind of working in two small hospitals in the intensive care unit. So, we're doing the workforce capacity buildings, knowledge transfer, strengthening health systems, and then really trying to, procure supplies for laboratory needs, as well as, for infection prevention and control. But I think for sustainability, we've already started talking with the leadership. How do we expand this beyond our unit, to other, sites within the hospital, or how do we expand this to another facility? So next year, we're actually going to add another facility to see if we can implement this based on what we have already learned. But we really do need funding, right, in order for us to do this. And I think GAIN-AR has been able to provide critical, technical, subject matter expert, hands-on training knowledge, which has been great, but really still need that funding efforts from both national as well as others in order to expand this and sustain these efforts.
Thank you. Thank you, Sue. Thank you for those thoughts. And Fernanda, last but not least, I'd like to turn it over to you for your thoughts.
Thank you. And I'm so happy that Sue brought up the financial aspects, because for this question, really, I was trying to think very broadly, what really needs to be done to sustain our efforts, of GAIN as part of the Global AR Lab and Response Network. And in my mind, it's really critical to engage with Ministry of Health, national public health laboratories, local partners, professional microbiology and infection prevention control societies, really to get their buy-in, continue to provide that expertise. So in order for the countries really to scale up all their efforts, I fully agree that they need to have dedicated resources. And many countries have put together, as we know, national AR action plans, but they have been having difficulty to implement those plans. And the main difficulties are related to lack of financial resources for implementation. And infection prevention control legislation that address prevention and control of AR is necessary. In my mind, I think that needs to be done across countries. For example, Argentina passed this past August their first law for prevention control of AR. And without laws, hospitals are not compelled to invest in IPC. And also without laws, it's really difficult for the government and hospitals to have dedicated budget for IPC and AR programs. I also think that countries should take the opportunity now, take the advantage of recent funding opportunities that came because of COVID-19 for both IPC and AR that can help sustain and expand their efforts to improve infection prevention control and combat antibiotic resistance. So I want to leave everyone here with those opportunities, additional opportunities for funds to sustain those activities for IPC and AMR. And both the Global Fund, the Pandemic Fund, now have opportunities for countries to apply for IPC and AMR funds, and countries should take advantage of these opportunities to sustain and even expand their efforts. So those are my final thoughts. Dawn, thanks so much.
Thank you, Fernanda. Really appreciate it. And thanks to all of you for those very insightful responses to that question. Before I move into sort of closing remarks and wrap up, I just want to reach to each of the speakers And not to put you on the spot, but if anyone has any final thoughts that you would like to share before we close, I would like to give you that opportunity. So not sure if anybody has any thoughts, but if you'd like to, please feel free to come off mute.
Maybe I have one suggestion. That's to congratulate to CDC for this important initiative in health diplomacy and promoting global health. And I guess we could have meetings from countries and public systems who are similar in their challenges, and to share experience based on, the support we receive from CDC, how we surpass our difficulties, the results we are obtaining. I think one possibility would be to have more specific meetings with more equality in terms of the difficulties we have, for sharing experience that could optimize the results of our initiatives. Thank you once again for the opportunity.
Thank you, Arnaldo. Thank you for that, and for that suggestion of increasing collaboration and communication for supporting each other. Any other thoughts?
Donna, I'd just like to echo those thoughts from Dr. Colombo. Thank you for the opportunity for allowing us to present our work. I've learned a great deal from the panelists, and I thought this was a really nice opportunity for us to share and learn from each other as we work towards building this really important network. So thank you.
Thank you,
Yeah.
Christy.
And I also want to echo, thank you for the opportunity to present not just our successes, but our challenges as well. And it's been wonderful working with GAIN AR. Thank you.
Thank you, Sue.
And I guess I would just close to really thank you for, I think that this is just really the start of this exchange. Fully agree with Arnaldo that, it's really important to have what I was calling community of practice, where we really share like lessons learned across the global community. And again, I hope this is just like a start of many more AMR exchanges.
Thank you. Thank you all very much for those closing remarks, and thank you for taking that time. So I think now what I'd like to do is we've got a slide that we would like to show, and I love this slide. I'm gonna wait for it to come up. So at the opening of this webinar, I showed you a map of the extensive work underway across the globe to combat antimicrobial resistance through the Global AR Lab and Response Network. And today you've heard about some specific projects and all the great work that's happening within those efforts. I then acknowledged at the beginning that we could only highlight a few of those specific efforts today, as we did. So we wanted to share this slide to recognize all of the vital partners that are currently engaged with us in the hard work to combat AR through this Global AR Lab and Response Network. So I'd like to take a moment, and we wanted to show you the list so that you would be able to see, and we could express our very big thank you to all of our partners that are working with us currently under the Global AR Lab and Response Network. We recognize the importance of continuing our focus on identifying risk factors that are driving the emergence and spread of AR threats across One Health, and the immediate need to respond to these threats across healthcare, the community, food, animals, and the environment. Our hope and intent for the Global AR Lab and Response Network is to continue to expand to new countries and with more partners worldwide. We look forward to our continued work with partners, country leadership, ministries of health, and other collaborating groups to build laboratory detection, response, and infection prevention and control capacities and capabilities in countries, so that this expertise is foundational and will become established and sustainable. And so that data systems will be available to be leveraged for public health action and used for decision-making, and to continuously innovate and improve our ongoing efforts to combat AR. So in closing, I would like to express my sincere thank you to all four of our speakers. It's been an absolute pleasure to learn so much about these important AR efforts, that are part of the CDC Global Antimicrobial Resistance Laboratory and Response Network. And we appreciate all of the information and insights that you've shared with us today. I also want to thank all of you who have joined us to be a part of these conversations. Your time and interest highlight just how vital it is for us to continue our efforts to strengthen capacities around the world for AR detection, response, and infection prevention and control, to decrease the impact of AR on human health, the health of our communities, animals, the food we eat, and the environment as a whole. As a final reminder, the webinar has been taped and will be posted as soon as it's ready. You'll be notified via email per your registration information, so please watch for that. Thank you all, and a good morning, good afternoon, or good evening to all of you.